functional things. Look up at the ceiling, look down to tie their shoes. Someone calls their name, be able to look over their shoulder, be able to tilt their head left and right. So you have cervical flexion, you have neutral spine, neutral, then you have cervical hyperextension, then you have rotation, and then you have lateral flexion or side bend. So I like to do this without a pillow, but when you're working with a patient, you know, you may have a hard time having somebody let go of their neck and giving you complete control of their head. So you may have to start with them on a pillow like this. So here, if I had my hands here and I'm on Danielle's head here, I could hold here to give her some input that I have a hold of her neck. My hand here is going to bring her up into flexion. So it's kind of this movement here. Okay, so that's one way, relax. That's one way. Another way is if I'm here and I want to do rotation, I'm rotating. Now, whether I want to rotate both ways, I certainly can do that if my patient lets me. Or I could just do 10 reps to the left, 10 reps to the right, which is what I prefer. Then for side bend, again, it's bringing them as far as they can go. And this is passive. So I'm not stretching. This is how much movement she has. But for me, relax, it's much more comfortable if I can hold her head. Okay? And so here's my pattern. I let someone's head and neck rest on the table. If I was doing something like this, relax. If I was doing something where I want to stretch her muscles out like this, and I'm sitting, I'm perfectly fine doing this. If I stand, I can do this. Okay? On your belly, real quick. On your belly. In this position here, if I want to do some work with her back, I can do this. But you guys see the problems with that. So this is the trusty, handy-duty pillow condom. So now if I'm in here like this, relax. So now I'm in here like this. If I get too close and she feels something, she's feeling the pillow. So I can go ahead and do my work, and I'm fine. You know, she could take my pillow to court, and that's okay. You know, but if I'm not having that, I put myself at jeopardy, and that's what happened to one of our students. He was working with a patient, and he was doing some work, and there was a claim made. It was ridiculous, actually. So, anyways, just to be aware of that. So she supported. Here's what I like to do, guys. I have her head, and I like to just kind of do just a little bit of a massage, a little bit of a rub, just to get her to relax. She can feel whether I'm hunched and I'm flexed and I'm tight, or she can feel whether I'm loose and I'm relaxed. So the more comfortable you are is gonna impart to them. You have to pay attention to your postures. If you have shoulder, back, and you're sore in a position, you have to change so you're comfortable. Okay? So again, I'm here, and my movement is going to be, I'm going to do 10 reps. You know, so you relax the head, you relax the weight of your head. 1, and relax, and 2. Now she could tell you, do 5 on your own. So now she has to use these muscles to overcome the weight of her head, and that could be tough on her muscles. That could be tough on her spinal discs. So if I'm here, relax, and I'm doing it for her, it's like, wow, that's easy. I can tolerate that. Flexion. If I want to do rotation, 1, again, I like to go to one side. I'm not stretching. If I were to be stretching, I'd have to go right here to stretch. But I'm just doing range. I'm just trying to preserve what she has. Okay? If she had a car accident and she had a bit of a whiplash and she came into my clinic and I'm her therapist, in the acute phase, I'm trying to reduce the inflammation. So we can use ice. She maybe was immobilized for a little while, but now we need to start getting motion back. I'm going to be the one to get it back for her. So I'm going to say, okay, we're going to go this far, relax. And she says, okay, I can take that. Now if I try and go here, and she goes, that is too much. My range of motion is going to be from 0 to about 30. That's it. That's all I'm doing. Range of motion is okay in the inflammatory phase. Passive range of motion. Passive. There's a pumping action that occurs that can also help. Now, if she says to me, I have pain, I'm going to stop. If I start turning her head and her neck muscles tighten up, they call that what? Muscle apprehension. Muscle guarding. So if she starts to have muscle guarding, I'm going to stop. Because the whole point of passive range of motion is my patient not contracting their muscles. You guys following? Yeah. Okay. So rotation. For side bend, again, I'm going to hold the weight of her head. I'm going to bring it over here. 1. So this is nothing for her. She's not having any motion at all. Nothing hurts. But now if I do this, and now if I do this, now I'm putting a stretch on all these structures here. Now that's different. That's stretching. That's not passive range. Yeah.
The side bending, are you actually clearing her head off the table? Or are you sliding her head around?
Good question. I'm holding her head in my hand, so her head is not on the table. And my hand is sliding on the table.
Would it be wrong to have her head slide on?
If it's a friction-free surface, if she can do this here, try and go side to side. If she can do that and she can slide, okay, that's acceptable. If she can't, then it won't work. What I use at home, guys, is a cardboard box. You take a cereal box and you break it down, so now it's flat, and you put a little baby powder on the cereal box, and it's only that big, right? So she's only going to go from here to here on the box. So that's friction free. That's not her bed sheet. Okay? So I want you guys to put your hands on each other, and this is the last thing we'll do today. Cervical range. Flexion, rotation, side bend, no extension or hyperextension. Okay?